This case took less than 5 minutes to diagnose, but the patient had been living with it for nearly 6 months. A 52-year-old woman walked into my clinic. Before she even sat down, she looked at me and said, "Doctor, I think there's something wrong with my brain." "Okay, tell me more about what's been happening. We'll figure this out together." "Doctor, I think there's something wrong with my brain." I asked, "What makes you think that?" She replied, "Every time I lie down in bed, the entire room starts spinning. Not lightheaded, not slightly dizzy, the whole room spinning, like I was on a roller coaster. The strange part? It would last only about 10 seconds, then disappear completely, until the next time she lay down. If you were the doctor, what would you think? A stroke? A brain tumor? A balance disorder? Or something completely unexpected? Whenever a patient tells us, "I'm suddenly dizzy," there's one diagnosis we must never miss: a stroke. So we started asking questions. Any weakness? No. Facial drooping? No. Difficulty speaking? No. Double vision? Every neurological exam was completely normal. If this were a detective story, our first suspect had a solid alibi. Case dismissed. Could a brain tumor be causing her symptoms? Probably not. Brain tumors don't usually appear only when you lie down. They don't disappear after 10 seconds. And they certainly don't happen only when you turn your head to one side. Once again, the evidence didn't fit. Another suspect eliminated. What about an inner ear infection? That sounded much more likely. Inner ear infections can absolutely cause severe vertigo. But patients are usually dizzy for hours, sometimes even days. Many also develop hearing loss, ringing in the ears, nausea, vomiting. She had none of them, not a single one. Her dizziness happened only when she changed the position of her head. Lie down, sit up, roll over, the room spins. 10 seconds later, everything becomes normal again. That tiny detail changed everything. Because at that moment, one diagnosis immediately came to my mind. A condition most people have never even heard of. I asked her to lie back on the examination table. Then, I gently turned her head to the right. Within just a few seconds, she grabbed the sides of the bed. "Doctor, it's happening again. The room is spinning." At the exact same moment, I wasn't looking at her face. I was watching her eyes. Because sometimes, the eyes reveal the truth. Long before the patient can describe it, her eyes began moving rapidly, back and forth, in a very specific pattern. That movement wasn't random. It was a clue, a very important clue. In medicine, certain eye movements are almost like fingerprints. They point directly to the diagnosis. At that moment, I was almost certain we had found our culprit. It wasn't her brain. It wasn't her blood vessels. It wasn't her nerves. The real culprit was hiding much deeper, inside the inner ear. The diagnosis was Benign Paroxysmal Positional Vertigo, or simply BPPV. It's one of the most common causes of vertigo. Yet surprisingly, many people have never heard of it, and the cause is almost unbelievable. Just a few tiny calcium crystals, smaller than a grain of sand. How could something so small make an entire room appear to spin? To understand that, we need to travel inside the human ear. Imagine shrinking yourself until you're thousands of times smaller. Now, you're standing inside the inner ear, one of the most remarkable balance systems ever created. Hidden deep inside are three tiny semicircular canals. They constantly monitor every movement of your head. Nearby are thousands of microscopic calcium crystals. Normally, these crystals stay exactly where they belong, helping your brain detect gravity and motion. Think of them like tiny marbles, resting safely inside a small container. But sometimes, age, a minor head injury, or no obvious reason at all, can loosen them. Instead of staying in place, they drift into one of the semicircular canals. Now the real problem begins. Every time you roll over in bed, sit up, or look upwards, those tiny crystals begin to move. As they slide through the fluid, they create signals that shouldn't exist. Your inner ear tells your brain your head is still moving, but your eyes say, "I'm perfectly still." Your muscles say, "I'm not moving either." Suddenly, your brain receives three completely different messages, and it doesn't know which one to believe. The result? An overwhelming sensation that the whole room is spinning, even though you haven't moved at all. At this point, most people ask the same question. If these attacks are so severe, why not just take medicine? It's a reasonable question. But here's the problem. Medication may reduce the sensation of dizziness, but it doesn't remove the real cause. Imagine a pebble trapped inside your shoe. You could take painkillers to make your foot hurt less. But until you remove the pebble, the problem is still there. BPPV works in a very similar way. The loose crystals are still floating inside the balance canal. No medication can simply dissolve them or move them back where they belong. That's why one of the most effective treatments for BPPV isn't a pill. It isn't an injection, and it certainly isn't surgery. Instead, it's a carefully designed sequence of head movements. Think of it like solving a tiny puzzle. The crystals are in the wrong tunnel. Our job is simply to guide them back home. One movement, pause. Another movement, pause again. Each position uses gravity as the treatment. No lasers, no machines, just physics working inside the human body. Slowly, those tiny crystals begin to move. They leave the semicircular canal and finally return to the place where they belong. For many patients, that's all it takes. After completing the maneuver, I helped her sit up. We waited quietly, just a few seconds. Then I asked, "How do you feel?" She looked around the room. She turned her head to the left, then to the right. She looked surprised. The room isn't spinning anymore. For the first time in months, she wasn't afraid to move her head. Moments like these remind us why an accurate diagnosis matters. Because treating the wrong disease can waste months, but treating the right disease can change someone's life in minutes. 1 week later, she came back to see me. This time, she wasn't holding onto the wall. She wasn't afraid to lie down. She smiled before I even asked how she was doing. "Doctor, I've been sleeping normally again. No spinning, no fear." Then she laughed. I never imagined a few tiny crystals could cause so much trouble. Honestly, most people don't. But before she left, she asked one more question. Can this happen again? The honest answer is yes. For some people, BPPV may return months or even years later, especially as we get older, because those tiny calcium crystals can become loose again. The good news is that recurrence doesn't usually mean something more dangerous has happened. In many cases, the same repositioning maneuver can be performed again, and many patients improve just as quickly as they did the first time. When dizziness is an emergency. But here's something extremely important. Not every spinning sensation is BPPV. Sometimes, dizziness can be a warning sign of a medical emergency, especially if it happens together with weakness or numbness, difficulty speaking, difficulty walking, double vision, a severe sudden headache, or loss of consciousness. Those symptoms require immediate medical attention because they may indicate a stroke or another serious neurological condition. Never assume every episode of vertigo is harmless. Medicine is a lot like detective work. The symptoms are the clues. The examination collects the evidence. The diagnosis reveals the culprit. Only then can the right treatment begin. In this case, the criminal wasn't a tumor. It wasn't a stroke. It wasn't even the brain. It was something smaller than a grain of sand, yet powerful enough to make an entire world appear to spin. That's why the greatest tool in medicine isn't always a new drug. It isn't always the most advanced technology. Sometimes it's simply asking the right questions, looking for the right clues, and making the right diagnosis. Because one correct diagnosis can change a person's life in just a few minutes. I'm Dr. Tien Tran. Thank you for joining me on today's medical detective case. If you enjoy real medical mysteries, explained with science, subscribe because our next case may surprise you even more.